Crystal Scott's life changed forever one morning.
I went to brush my teeth and get ready, and I had to sit down on the tub to finish brushing my teeth because I was too weak to stand.
Scott's roommate called an ambulance for what they believed was an asthma attack. During the ambulance ride, Scott began to worry.
I watched my blood pressure be an obscene number, like 237 over maybe 150, 160.
Scott soon learned that she was experiencing kidney and heart failure.
And I was in ICU for 3, maybe 4 days, and then moved on to a medical floor, and was in the hospital for 3 weeks.
Dr. David Mahoney is a nephrologist with over 18 years of experience in the metropolitan area where he treats all aspects of kidney disease. He says it's very common for a person to be unaware of a problem developing.
Kidney function is divided into 5 stages. Most people would make it into late stage 3 or early stage 4 before they had any inkling that anything was wrong. There usually aren't any symptoms or red flags until things are very advanced, and that's really the tragic part, that you can't address a problem that you don't know about. And so a lot of people are appearing very, very far down the road in their progression of kidney failure, and they had no idea.
According to the American Kidney Fund, African Americans are more at risk for kidney failure than any other race. More than 1 in 3 kidney failure patients living in the United States is African American.
If you were to take an African American man who was the same as me in every respect, age, height, weight, blood pressure, medications, health concerns, all of that, if the only difference that we had was race, he would be many times more likely than me to develop kidney disease. The reason for that is unknown.
While researchers continue to look for answers, there are many known factors that contribute to kidney disease.
High blood pressure is probably the second most common cause for kidney failure in the United States. First is diabetes, and high blood pressure coupled with diabetes is probably the most common culprit.
African Americans are almost twice as likely as whites to have diabetes, and 42% of African American adults have high blood pressure.
In this area, the Washington, D.C. area has the highest incidence in the country of kidney disease. And it is unclear exactly why that is. There is a lot of hypertension in the area, and clearly if kidney disease is recognized early, we can definitely intervene.
The American Kidney Fund brings Kidney Action Day to cities where rates of kidney disease are higher than the national average.
I'm LaVarn Burton. I'm President and CEO of the American Kidney Fund. Welcome everyone to Kidney Action Day. Today we're doing free screenings, we're providing educational material and education sessions, and we're also providing entertainment and fun on fitness and exercise. We're doing some line dancing. The kids have a moonbeam jump. And guess what? When you leave here, what we want you to do is to follow our strategy of pairing up. Pair up with a loved one, with a family member, and help them to be more aware of the disease, to get tested and to know their risk.
Well, as you can see, I didn't walk, I ran in this race, but really the point is Kidney Action Day, to bring attention to the impact of kidney disease in our county and our communities, the impact on families and on patients, what we can do to prevent and to treat kidney disease. You know, I've met actually some really wonderful people, patient advocates who just received a kidney themselves, and so they can go out and tell the story of what it means to have their lives transformed with a new kidney, because we need donors.
Ellery Payton is a patient advocate who found his donor on Facebook.
Through Facebook, in January of 2012, I found my donor, who was actually a member of my church. And he read on Facebook that I needed a kidney transplant. And he went and got tested. And through God's grace, he was a match. So he went through all of the testing, and we pretty much became really close throughout that, and ended up scheduling our surgery for July of 2012. I had my second kidney transplant in July of 2012. Since then, it's just been great. I feel healthy. My creatinine numbers are well. My blood count numbers are well. I feel great. I'm able to exercise and live pretty much a normal life.
Team Tony was honored at Kidney Action Day. Tony Sims is awaiting his second kidney transplant.
My name is Maddie Sims. This is my husband, John. This is my daughter, Zatia. This is Tony. This is his family in the background, his brothers and sisters. In 1994, Tony was diagnosed with a renal kidney failure. His sisters, I tell you, all of us were tested, none of us matched. She was a good match, so she gave him a kidney. So the kidney he had how long? 17 years. Okay, we're at a point now where he needs another transplant. So we're doing everything we can to make people aware, become donors ourselves, so that we can get the word out about transplants.
According to the Organ Procurement and Transplantation Network, there are currently over 118,000 patients waiting for organ transplants. Of that number, 97,000 are waiting for kidneys.
More people do need to register to become donors. It is a big deal.
The boxes behind Scott are packed with her month's supply of fluids. This machine allows her to self-administer her peritoneal dialysis at home. She spends 8 hours a night on the machine and will continue to until she is able to receive a transplant.
I would joke about my machine being loud at night and I don't get very good sleep. And I said, I'll sleep in 6 years after my transplant.
There's absolutely no reason that organs should go to waste. I think a lot of people look at organ donation as saying that if, for example, if you have an accident victim, if something horrible has to happen, that someone is going to lose his life in an accident, at least something good can come of it, that somebody can benefit from the organs. And it's not only kidneys, but it's skin, eyes, liver, lungs, heart. One tragedy can lead to dozens of good outcomes. So I think that everybody should volunteer to be an organ donor.
According to Donate Life America, 90% of Americans say they support organ donation, but only 30% know the essential steps to take to be a donor. Go to www.donatelife.net to register in minutes. Thank you for watching this special report. Go to WashingtonInformer.com for more news.